Hello. Today, let's talk about history taking and the physical examination of the patient. There are like five principles of history taking. There is an introduction, the history, the examination, the diagnosis, and the management. But today, we are going to look at introduction and the history itself. So, first of all, you need to introduce yourself to the patient. Then, you need to explain who you are and what you are doing. Then lastly, you need to ask for permission to carry out the history and the examination. So starting with the history for today's video, the first part is demographic information of the patient. You can use a mnemonic NAMSTROM, which stands for name, the age of the patient, marital status, sex, tribe, religion, occupation, address, and lastly, the mode of admission of the patient. Was it self or was it a referral from another hospital? The second part is the chief complaint or presenting complaint. This is what made the patient to come to the hospital. It may be, for example, diarrhea. Diarrhea might be the complaint. So this is usually patient's own words and it is written in a chronological order, recent or recent to order complaint or order to a recent complaint. It depends on your facility, what your chiefs like. Also, the very important thing is the time course. And the chief complaint can maybe more than one, but not more than five. So, for example, the patient has been experiencing diarrhea. You need to write maybe diarrhea, and the time course may be 2 weeks. So, the chief complaint is diarrhea for 2 weeks. The other important part is history of presenting illness, or we call it HPI. This is the very important part of your history, and this is where your diagnosis comes from. Your 40 to 50% of your diagnosis comes from history of presenting illness or your HPI. So here you give the description of each separate symptom. Here you need to amplify your symptom and let the patient tell the story of each individual complaint, and from there you need to make it a history. Most of the time in HPI we use this mnemonic in order to amplify the complaint. There is Socrates and there is Don Para. Socrates stands for the site of the site of your complaint. eh, The onset, was it sudden or gradual? The character of the pain, is it a throbbing pain or is it what kind of pain? Radiation, where is it radiating? Associated factor, time course, which includes progression and the periodicity. Exacerbating factor, these are the factor which makes it worse, and the severity. Is it severe that the patient cannot do activity of the daily living or what? So most of the time, Socrates is preferred in complaints which are related to pain. For example, abdominal pain. You can use Socrates. And don't para, the other, it is used for complaints which are non-pain mediated or non-pain related. Don't para stands for the duration, onset, nature, periodicity, progression, associated factors, relieving factor, and aggravating factors. So these are the things which are included in your HPI. Most of the things we have already discussed in the mnemonics, but the added things is past history, which includes the similar symptoms in which the patient has been experiencing in the past few weeks, maybe or few months ago, the investigation and the treatments. Maybe the patient had went to a health facility during his or her illness, and there were some investigations which were done and the treatments in which the patient were undergoing or was undergoing. The other thing is you need to incorporate relevant systemic review into your HPI. For example, the patient is experiencing respiratory complaint, and respiratory system is related to cardiovascular system because both of them are in the chest cavity. So respiratory system and cardiovascular system, they are related. So that system is relevant to your system of which you anticipated to be involved. Also, you need to include the current treatment and list the medication which the patient is taking currently. The fourth part is review of other system. You need to review other systems to make sure that there are no other systems which are affected. Yes. The other part is past medical history, very important. Here it includes the number of admission or hospitalization the patient had been having, the number of accidents or what type of accident the patient had experienced, surgeries. Here you need to include the type of surgery and the time the surgery was done and the health facility where it was done. Also, don't forget about chronic illnesses of the patient. For example, chronic infections such as HIV, TB, diabetes, maybe the patient is having, or hypertension, and other chronic illnesses. You need to include them here. Don't forget the history of blood transfusion and allergies, because at the end of your history in the part of management, you are going to determine or you are going to find out what kind of medication to give the patient. So you don't want to give the patient a medication in which the patient is allergic to. The other part is, for example, you are in pediatrics, you have received a child, you need to include prenatal history, natal, postnatal history, immunization, dietary, and developmental milestone history. If you are in OBGY, you have received a female patient, you need to include the gravidity and the parity of the patient, the number of pregnancy and live births, the menarche and the menopause of the patient, and menstruation, the cycle and duration of the fall. In family history, you need to record the number of first-degree relatives the patient is having, for example, the siblings, the parents, and the children. And if you are anticipating a hereditary disease, you need to inquire if another family member is affected. In social history, you need to inquire about smoking history, and it is usually recorded in pack years. This is a formula to calculate pack years. Pack years is equal to number of cigarettes smoked per day divided by the total number of cigarettes in a packet or in a pack, which is 20, multiplied by the number of years the patient has been smoking. For example, the patient is smoking 20 cigarettes, so it is in 2 years, within 2 years. So it is 20 divided by 20 times 2, which equals to 2 pack years. Also, you need to include the amount of, if you need to include the alcohol history, if the patient has been taking alcohol, the amount and duration. For example, the patient has been drinking maybe 2 liters per week. So the alcohol is history becomes 2 liters per week. Sometimes you might include dietary, estimated calories intake per day if indicated, and exercise, the daily and the amount of exercise, maybe 150 minutes per week. That is the recommended amount of exercise to be done per week by WHO. The other important thing is marital status and the household dependence, because maybe you have finished taking care of the patient in the hospital, you want to discharge the patient. So you need to know if the patient will receive help when he or she goes back home. That's how you inquire the history of household dependence. These are the key points to history taking. You might want to pause the video and go through with them so that you can be able to become better in history taking. And these are my resources. And don't forget to watch the other video for physical examination of the patient. Thank you for watching, and don't forget to subscribe if you have not subscribed to my YouTube channel. Thank you and have a good day.